Namaste, all of you. I'm Dr. Balwinder. I'm from WHO, Country Office for Nepal, and I'm here to talk about something which you might know, which you might not know. It's about cervical cancer, preventing cervical cancer. No woman dies of cervical cancer, is what my main theme is going to be, and well, it is humanly possible. Now, just imagine this. Zzz, boom! It's a crash. Imagine one plane with 1,000 people on board crashing every day. Imagine all the people on the plane are women, all 1,000 women dying every day. Someone, somewhere in the world. It could be your daughter, it could be somebody's wife, it could be somebody's mother, somebody's sister. So, ladies and gentlemen, I'm going to take you through not a story about myself, but a story of Nepal. A story where Nepal is using the power of vaccines to move forward, to make sure Nepal is achieving control, eradication, and elimination of vaccine preventable diseases. Let's have some global facts. Cervical cancer happens to be the fourth leading cause of cancer and cancer deaths in women around the world. 6.6 lakh cases every year of cervical cancer, 3.5 lakh deaths every year. More than 90% of these cervical cancers are because of one infection called as HPV infection, human papilloma virus. We know the enemy, we have the ammunition. Now is the point to take that ammunition and say, boom, 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 you need to go. This vaccine, which I'm going to talk about, the HPV vaccine, it came into existence in 2006. Developed countries immediately got it because they could afford. They got it, they started giving, all fine. But it is our countries, it is lower and middle income countries that are having most of this disease burden. And I think Nepal is fortunate to have had this vaccine in 2025. Talking more on this HPV vaccination is not just a shot, it is a shield around you. It is a shield that's going to protect you. HPV, what is HPV virus or what is this HPV infection? This starts when girls and boys they get into sexual activity. So this vaccine is supposed to be had before you begin your the sexual life. That's why this vaccine is given to girls between 9 years to 14 years of age so that they remain protected. A single shot is good enough to tackle 95 to 98% of infections and keep each one of you safe. What an amazing scientific breakthrough this vaccine is. Is it only one shield that we want? No, no, no. There are so many shields which are already present, and I'm sure most of the people here in this hall, because you are in Nepal, and Nepal has one of the best immunization programs in the world. I won't hesitate saying that. Yes, in the world. I'm sure most of you would have had vaccines to protect against all these. So you are kind of shielded. Is immunization just a tuck, 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 tuck? Or there is some hard fact, hard data to support what we all say? In the last 50 years, 154 million lives have been saved with the vaccines. So technical data. What is 154 million? 15 crore. 15.4 crore lives have been saved. That means 6 lives every minute. Imagine. Start clocking it now. 1 minute means 6 lives saved because of vaccines that are being given around the world. Someone somewhere is getting it. 8,000 lives saved per day for the last 50 years. The contribution of vaccine has been such that 40% decline in the child survival for infant mortality has been because of vaccine. It has been one of the biggest contributor. Now, coming to this, we say we save lives, we avoid deaths. And when we say we avoid deaths, we also mean we are gaining on good, healthy years. So, one life saved means 66 years of healthy life that a person gets on an average. And if you do some math, the contribution of vaccine has been 10.2 billion years of life has been gifted or blessed to people around the world. Moving forward, everything is not rosy as it looks. It's not so beautiful. The world is not so great. It really is. But when it comes down to inequities, there are people who can afford, they take it. There are people who cannot afford, someone somewhere not aware. Parents are busy. They've not seen the disease. They don't care. Let's talk about measles vaccine, one of the shields that I talked to you about. Over 93 million lives have been saved in the last 50 years using this vaccine. For you, it is a vaccine in the pharmacy store somewhere lying, and maybe we don't know what vaccine is. No, no, no. Cope, sui. No, 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 no. No, no, no. Time to change. COVID 19 has been an example, a very strong example. People went all out. They were trying to give extra money to get the vaccine because you wanted to save yourselves, you wanted to save your parents, you wanted to save your family members, your loved ones. So I'm talking now about measles vaccine. It is a vaccine that accounts for 60% of all vaccine preventable lives saved so far. 60% contribution is because of this vaccine. But 2022 data says 33 million children did not get it. Either vaccine was not there, or the person who had to deliver wasn't giving, or there was some issue, awareness issue, not bothered. Life moves on. What if one person dies? It's okay. We could have saved so many of them more. When you know it saves, still vulnerability exists. Moving forward, let's have a quick now getting into the Nepal story. Nepal's immunization program has been an example for the world. Small country, but the way the systems have been built over the years, this is the story I'm going to talk about. Looking at Nepal as an example of moving from point A to point B, where it's going forward, making sure that it's eliminating, it's eradicating, and it's controlling the diseases. This program is housed under Family Welfare Division, District Department of Health Services, under Ministry of Health. Amazing team that works there. We as partners, the core partners happen to be for government. It's a Gavi, we from WHO, UNICEF, and so many other professional bodies, etc., are ones we are supporting. Some key achievements: Nepal has been already certified for polio free status, certified as rubella and congenital rubella syndrome control, hepatitis B control, and also maternal and neonatal tetanus elimination. Now we need to get more aware because something that we have recently introduced, we are going to talk about it. How many deaths are happening in Nepal? Imagine that plane. Boom! In that plane, we said there were 1,000 women. In those 1,000 women, there were 4 Nepali women as well, for you to understand. So, 4 Nepalese women are dying every day. The issue is, globally, this is the fourth leading cause of cancer, right, in women. In Nepal, it is the number one cause of death in women as per the registry that we have sourced here. Number one. So, this requires immediate thought and no two time thinking. If something is to be done, it's to be done now. When? Especially when Nepal has already introduced this vaccine for free. Now, looking back at this HPV vaccine, which has now got introduced, when did it got started? It got started in 2013. The program got started. There were decisions made, and in 2016 and 17, the journey has been long. 2016-17 in Kaski and Chitwan, a demonstration program, a pilot was started to look at the safety and efficacy of vaccines. It went on smoothly, but because of global supply issues, COVID 19 wrecked the whole world. This was stopped, and slowly we now move forward to 2025. But before that, I would just like to link this vaccination with a global strategy to accelerate the elimination of cervical cancer. It's not just only Nepal. This is a strategy that has been developed to accelerate our efforts to make sure we get this cervical cancer out from our lives. And that strategy is called as 90 70 90. 90 70 90. First 90 is make sure that every girl under 15 years of age gets a shot. 90% girls get a shot of HPV vaccine, a target. 70 is this is be thoughtful on it. Every woman up to age of 35 should be screened at least once with good performance tests to see whether you have cervical cancer or not, whether you have HPV infection or not. Every woman until the age of 35 once, and second time by the age of 45. And the last 90 is if at all the cervical cancer gets detected, it is treated and managed. 90% cases should be treated and managed in time. This is the strategy that global WHO experts have come out with. Nepal is a signatory and we are moving forward for it. We had more than 52,000 female community health volunteers who came forward, who were trained, who were provided all the tools to go to the community, talk to the community, make sure that the girls who are in school are get vaccinated in school, and the girls who are out of school, who do not go to school, also reach to a nearest vaccination center and get vaccinated. More than 30,000 schools were involved. 30,000 immunization session sites were made in the schools. Close to about 18 to 20,000 additional immunization sites or places were formed outside the school so that out of school girls could also come. So this force began mobilizing children for the D-Day, that was 4th of February 2024 onwards. Then we had the health worker, the vaccinator, I call the eliminators. They came forward, almost like 27,000 in number. They came forward, a very well-trained workforce. It's been an example because now the campaign is over. We'll come with the results, but imagine amazing performance. And then comes like 30 to 40,000 teachers in schools who voluntarily came forward and became volunteers to support the program, and look at what kind of advocacy they gave to their students and the parents, that they turned out in huge number. And the result has been, we started with a bang. Achievement was 1.4 million eligible girls in Nepal get this life-saving vaccine in 2 weeks. We vaccinated, yay, proud. 1.4 million. Hey man, we started getting calls from all around the world. Hey Balwinder, amazing man. How did you do it? It's not done over day. Nepal has been doing this again and again through different campaigns. People were ready. The trainings, the support system, the resources were mobilized, and that's how we had this result. To see these girls stand and say, Safal Paro. Now, we vaccinated 1.4 million, and you would say, Baki kahan hai? Who were missed? We missed approximately around 60,000 girls. And do you know where we missed them? Those who never go to school, those who stay brick kilns, eat bhatta, those who are working in restaurants or small hotels. Those girls missed because either they were busy or they were totally unaware. The teams moved from point to search and understand the perspective of why we missed even 60,000, because today this vaccine, I think in the private sector in Nepal, it costs 7 to 8,000 Nepali rupees, is being given free of cost, but still people are not coming. This really felt very unfortunate for those 60,000. How I wish we could have got them out and given. Moving forward, the big challenge was the communication stuff. And the challenge is disinformation, fake news, and all malicious content coming on social media. This is a experiment vaccine. Nobody has looked at vaccine. वो पैसे खा गया, ये हो गया, what? People who have nothing else to do, who were trying to be a barrier between that shield and that little girl whom we are trying to save, come out with this. But we were ready. We were ready. I've had experience of working in many countries before. We were ready that this is going to hit us. We had a team, young girls and boys, sitting in Ministry of Health, sitting with WHO, sitting in UNICEF. They were checking and we were looking at, we were quickly doing fact check. If one negative message was coming, we were bombarding back with more than 10, 15, 20, 30 messages per day to make those messages according to what content they were creating, and then we were giving it back. It's like you give one, we'll give you 10 back. We took it very, very proactively. She is Miss Tamang. She lost her mother very recently to cervical cancer. Imagine, she was crying and she said, how I wish this vaccine was available. She asked the person supervisor there that really even one shot could have saved her if she would have taken long back in her earlier years. Answer is yes, but unfortunately it wasn't there that time. So this is a story about her. Story about a young girl, grade 7 student. She says, I don't know if my mother has cervical cancer now or not, but please, 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 thank you for vaccinating me and my sisters and my friends so that we will continue to live longer and be with each other more longer. This gentleman is father of a differently abled child. His child is already suffering from kidney disease, liver disease, so many other. But he got his daughter to get vaccinated, just saying that, sir, all that is fine, but I don't want my daughter to end up with cervical cancer now, for which now I know the treatment. I would like to kind of take a little pause and say, remember, guys, the HPV vaccine is not just a shot, it is a shield against cervical cancer. No woman should die of cervical cancer. But now, me being standing here in Nepal, I would like to say no woman in Nepal should die of cervical cancer because Nepal has a safe and effective vaccine for it. Is that possible? Yes, it is humanly possible. Ladies and gentlemen, thank you very much for your time.